Hey, it's Corey from mahalodotcom. You're about to see some screen tests of people who applied to be the host for our parenting channel. This is your chance to comment and tell us who you'd like to see become the next host. If you live in the LA area and think you could do a better job, we encourage you to please submit a video response telling us why you could be the next great Mahalo host. We really appreciate your feedback.
My name is Kimberly Durdin, and I'm a board-certified lactation consultant and a mom. As a consultant, I can work wherever I want, and I work with a lot of different places. One of the places that I work with is the Sanctuary Birth and Family Wellness Center, which is located in Los Angeles, California. And I also work with moms in Watts, California. I went to school and I have a fashion design degree. I went to Parsons School of Design in New York City. But after I worked as a fashion designer for a little while, but after I started having my children, I got really interested in working with moms, working with babies, all the things that, you know, become of interest to you when you become pregnant. So I breastfed my first daughter and got a lot of help from the community and an organization called Lactation League, which is a volunteer mother-to-mother organization which helps moms breastfeed their babies. And through them and through working with them and getting support from them, I learned about this profession called a lactation consultant, which is a person who's trained to help women learn about lactation or breastfeeding and also problem solve. Because sometimes moms have problems or difficulties and they need a little extra expert support. So basically, a lot of my experience first was through doing hands-on helping. I had about 6,000 hours of hands-on helping with moms before I was able to sit for the lactation consultant exam. So it was a combination of hands-on hours and then some coursework. And took me about 5 years to get all that together. And then I sat for an exam, what some people would say difficult exam, and I passed it and was able to start my profession as a lactation consultant. Well, one of the things I do is I teach a prenatal breastfeeding class. It's for the mom and her partner. Because both of them are going to have to work together to help to have a successful breastfeeding experience. And I think one of the big things that folks don't do is prepare themselves before they have their baby. Many times, you know, moms just think, I'll figure it out once the baby gets here. So, you know, I think I know for a fact that it's actually easier to help a mom when she's been getting some support before she even has her baby. Once the baby is born, she's on the job. She's starting to breastfeed within the first hour after birth. And, you know, there's a lot of questions that come up, and so preparation is a big thing in terms of helping moms become successful at breastfeeding and helping the family be supportive. But one of the big questions I get is always about making enough milk. Moms are always concerned, how is their body going to make enough milk to feed a human being? And so that's probably the #1 question that I get, and plenty of others. I have had a couple of television interviews related to breastfeeding topics. I have done a couple of educational videos for different independent producers who are putting together things for their own sale, I guess, in regards to childbirth and breastfeeding and parenting and things like that. And I've done a few sizzle reels, I guess they call it. We have our Sanctuary Birth and Family Wellness Center practice has had a lot of interest in terms of folks wanting to do a show about us, and so we've done some little sizzle reels and things like that. So a lot of moms are concerned when they are wanting to breastfeed or they are breastfeeding and they have to take a medication, and many moms are concerned how the medication is going to affect their breastfeeding. Some moms are even told that they cannot breastfeed if they need to take a medication, and that's really not true. The bottom line that we give all moms is that almost all medications are safe to take while breastfeeding. And another rule to think about is that most medications, almost all medications enter breast milk, but almost all of them enter at less than 1% of the maternal dose. So that means that less than 1% of that drug that mom is taking is actually getting into her milk. And that medication that gets into her milk and then ultimately gets into the baby, depending on the type of medication it is synthesized in the infant's body in different ways. So what moms should do if they are finding out that they need to take a medication when they're breastfeeding is they should tell their doctor, number one, that they're breastfeeding. And then if their doctor is not familiar with how to check on the safety of that particular medication for breastfeeding, the mom can take it the next step further. She can talk to her pharmacist, she can talk to a lactation consultant, and we also have some wonderful resources out there now for moms who are taking medications and breastfeeding. One of them is, one of our biggest resources is Dr. Thomas Hale, and he is a pharmacologist out of the university, actually a Texas Tech University, and all he does is study medications in mother's milk. And he's really our go-to guy. He has a wonderful book that he puts out every year that lists all the medications and their effect on the nursing infant and even the pregnant mom. And also he has this great new service where it's called the Infant Risk Center, where we can actually call Monday through Friday, the Infant Risk Center, located at Texas Tech University, and ask a question about any medication and see is it compatible with breastfeeding. So what moms need to know is that most medications are compatible, but they want to double check with a lactation consultant, their doctor, a pharmacist, or some of these other resources that we have before she makes a decision of whether or not she should continue to breastfeed.